Absolutely. So again, my name is Roland. So one of the things that I'm responsible for at the Office of Behavioral Health is the Options Public Health Campaign. So Options stands for Overdose Prevention through Intensive Outreach, Naloxone, and Safety. So I think the best thing right now is just I'm going to share my screen and we can take a look at, can all of you see this all right?
Yeah.
Great. Well, before I start, I always like to say thank you to the folks. I get to be kind of like the show horse and kind of present this to folks, but it really couldn't have been done without the contracts team, DCM, the leadership team at OBH, and the governor's office, and also the 55 plus community and state partners who are willing to sit in to do the interviews for this public health campaign, and then Mishmash and Blackfly Media that did a lot of the website that you're going to see in the videos that you might have already seen on TV. So to take a step back, why did OBH launch the Options program, right? So again, Options program is overdose prevention through intensive outreach, naloxone, and safety. It's because we expect over 500 overdose deaths in 2020. That's a 35% increase from 2019. One of the stats that I learned about the other day is that France, that has a population of 68 million people, only had 360 overdose deaths in 2017. We're a population of 1 million and we have over 500 overdose deaths. So it's really is upon us to really kind of reconsider how we're approaching this crisis. The other thing that's a really important statistic is that our kind of data analysts over at UMO estimate that for every fatal overdose, we expect that there's between 10 to 15 non-fatal overdoses. So that doesn't necessarily mean one person per overdose. It can mean, one person overdosing 3 times, for example, but it's still a staggering number and just goes to show the importance of our naloxone distribution efforts, but also goes to show that there's a hidden kind of part of the epidemic that's not really discussed when we just focus on the fatal overdose deaths. Another statistic that many of you may know that the CDC has put out is that 75% of heroin users and also now fentanyl users, started with prescription pills as their gateway drug, right? And then to complicate all of this, we have COVID-19 that has put a damper on a lot of our efforts because we know that the opposite of addiction is connection, and obviously because of physical distancing, it's very difficult for us and for folks struggling with OUD and SUD to be with each other. So before I get into our calls to action, I just want to note that the Options program has 2 different parts to it. The first is really kind of this public health campaign that I'm going to mention here. But the second is the kind of Options liaisons, which are kind of, SUD clinicians that are embedded within law enforcement in every single county. And their goal is to kind of do post-overdose response with folks who've experienced an overdose, see if they're interested in any referrals, as well as doing active outreach in communities that are at risk to do kind of promote prevention efforts, and again, kind of be a coordinator within those counties to make sure that all the different services from harm reduction to prevention to recovery to treatment are all working together. I know that Tri-County over in Lewiston has the Options liaison over there. So again, back to this public health campaign. The number one thing, again, because of COVID-19, is connecting people with local resources. On our website, we have over 100 localized resources that you can filter by county and by service so that folks kind of know what's around them. That's everything from an outpatient treatment to a recovery center to a Facebook group of just affected family members who want to talk with one another, want to know that they're not alone, right? The second thing is making sure that people are calling 911 for medical assistance. So we know that if people call 911 for medical assistance, they're much more likely to survive the overdose. But at the same time, there's a lot of concern from the community of people who use drugs that they're not protected, that if they call, they'll get arrested or the people with them will get arrested. So that's why we're also doing education around the Good Sam law that passed back in 2018 or 2019, excuse me. And this is education not only for the community members, but also for law enforcement. The policy, in the books isn't good if the law enforcement officer isn't abiding by it. So it's kind of a we're trying to educate both groups. But 80% of people who fatally overdose, do not use a loan. And so that's why it's also really important for us to focus on safer drug use practices, folks not using a loan, and what we are kind of calling having an overdose safety plan. So what does that mean? It can mean different things for different people. Sometimes, it is using with somebody, although we obviously do not recommend that because of COVID restrictions. Sometimes it's using with somebody else. Sometimes it's having somebody on the phone. That's really where we ask folks to contact the harm reduction or SSPs in their community to really talk about what's best for them. And then the fourth, obviously, is having naloxone on hand. If you overdose, the only thing that can help you is having naloxone. So, folks can get it at a pharmacy, but for people who are at risk, we also have, the state spends hundreds of thousands of dollars on purchasing naloxone, intramuscular and intranasal. And so, through our tier 1 and tier 2 distributors, folks can get naloxone for free. And so we want to make sure that folks are aware of that distribution and of the fact that they can get it pretty easily. So in January, in terms of the public health campaign, we have TV ads, which you might have seen. We have digital displays on Google. We have YouTube videos. We kind of started our organic social media. In February, we started radio ads. We're in Jumbo, Africa. We're doing paid social media. And then we're also going to start having ads up on like public transit all of these reflect our different calls to action. And then kind of the ongoing thing that we're doing is obviously doing kind of informational presentations like this, but also engaging with our community partners. Again, as I said, we did over 55 interviews with community partners throughout the state, from recovery centers to harm reduction groups. And so we want to make sure that we're, keeping those ties and hearing from them how things are working on the ground. So the other thing that was really key for us is that we built this campaign up in about 6 to 8 weeks, which was definitely a bit of a sprint. But what we heard from different states, as well as what we've heard from the National CDC, was that what really works is when you share personal stories and have those personal stories, have the calls to action with them. So we have 3 kind of what we're calling flagship stories. The Yankowskis, who are 2 state troopers who lost both of their sons within the span of a year to fatal overdose. We have Chantel, who's a mom in recovery, and then we have Dustin, who's 5 years in recovery, who's a lobsterman in the Mid-Coast area. And so, if we did a professional production for them, but we're also collecting kind of do-it-yourself home videos of people who are in recovery and sharing that on the website as well. This is just kind of like where we're spotted on TV. We also, again, on radio in Portland, Augusta, and the Bangor areas. What this shows here is that most of kind of the traffic that we're getting to the website is coming from our digital and paid campaign ads, right? And this is, kind of, we're hoping for folks to stay over a minute, to visit different pages, to download, different kind of like the strategic action plan, and then the external clicks, which is clicks out of the website. So again, we've listed over 100 localized resources. So we're interested in knowing, are people actually clicking those links and going out? And so we're going to have a lot better data for February. This was just the past kind of 2 weeks from when we launched on January 15th. And this is kind of like an example of what our Good Samaritan kind of law digital ads look like, right? So it's informing people that, when there is an overdose emergency, they should call 911, that they're protected. And then if they click on the ad, it goes directly to the part of the website where we have education around the Good Samaritan law. And we have the same thing for naloxone, for connecting with treatment, and so forth. So how are we kind of targeting folks, right? We're doing the TV ads so that there's a general awareness of the campaign, and also that it starts the conversation. Because of COVID-19, a lot of the overdose crisis has kind of taken a back seat. And so we wanted kind of the TV ads to kind of, bring this to people's attention. But it's very hard to track how well you're doing and whether the targeting that you're doing is actually affecting the people you want. And so that's why with kind of our digital ads, we're doing what folks call geofencing. So that's where we target kind of specific communities, and it can be specific neighborhoods even. And we're also and just kind of seeing, okay, if we push our message in these different zones, what is the feedback that we're getting? Are people engaging with our content or not? We're also geofencing around jails. So people who are coming in and out of jail, whether they're visitors, whether they're law enforcement, whether they're prisoners, they'll be getting our message as well. It's very hard to do it around healthcare facilities because there's a lot of laws, obviously, kind of protecting that information. So this is just some stats around our Google display. We've had over 250 million ad impressions, over 5,000 clicks to the website. Our YouTube ads have been kind of seen over 100,000 times. Over 50% or close to 50% actually watch the entire video, which we're pretty excited about. So people are actually engaging with the content. And then again, we have kind of our social media posts as well. So I just talked at you for, I don't know, a while there, but before I hop over to the website, I was wondering if folks had any questions that I could help answer real quick.
I just want to say the videos are so well done. They're so moving. And I saw the ad with the during Super Bowl. So that was really, that was a great marketing strategy.
Yeah, absolutely. Yeah, we were really excited to have the Yankowskis at the halftime show. And that really kind of all worked out last minute. So I'm super glad you saw it. So this is our website, right? So this is the options. It's knowyouroptions.me. And we have kind of the 3 videos here of Dustin, Chantel, Dave, and Shelly, who are the Yankowskis. This is kind of like their 1.5, 2-minute videos. So what you'll see mostly if you're on TV or if you're on YouTube is kind of that 15-second or 30-second clip, maybe that 4-second clip. Here you can watch their entire story. And then again, the focus here is that there are many paths to recovery. So, not just doing, the absence route, not just doing MAT, really say, if you're, using and all you want, what you need is just harm reduction, we're open to that, right? Because what the goal is that we want to keep people alive. If people are alive, then they can recover. If they're not alive, they cannot, they can't move on. And it's as somebody who is an affected family member, whose brother has overdosed multiple times and been revived, and who now is doing a lot better and is in active recovery, keeping folks alive is just so important. So here on the options page, or on the about page, you can learn more about options. You can look at the new strategic action plan that was just released last week. We have information around the opioid epidemic, Maine's Good Samaritan law, as we mentioned. Here we have kind of stories of folks, what we're calling voices of recovery. So it's folks from the community who've been willing to kind of share their story. We're always looking for more. So if you know of somebody who might be interested in just kind of sharing their story on this website, it wouldn't be on TV or anything like that. We'd love to have them up here. And that's either a video, or if they just want to write something, if they just want to write their story and be anonymous, we're really open to that. Again, the goal is to kind of destigmatize, the epidemic and folks who are affected by it. Now our Prevent Overdose page here, as you'll see, we'll have, how to use safely for folks, who are still actively using. We have how to respond to an overdose, right? So if you see an overdose happening, we have steps, and we also have a little video, how to get in naloxone. And important, going back to that statistics of 75% of people who are heroin users having prescription pills as their gateway, using, storing, and getting rid of medication safely is a huge part of that. So we're collaborating with the Eyes Open campaign from the Maine CDC, which you can kind of click on here and get to. But that's a really important part that I just want to mention. And then again, going back to those 100 localized resources. So if you are in Franklin County and you're looking for recovery services, here are some of the options that are open for you. If you're looking for harm reduction, these are the people you might want to contact. And so the goal here again was, creating something that was anonymous, confidential, and localized, because folks, from 211 is a phenomenal resource, but a lot of people are afraid to call 211, because they might be afraid that their kid might be taken away, is something that I hear very often. So what we tried to do here, and we're working in collaboration with 211, and 211 is part of this site, but what we wanted to do is create a kind of inventory of resources that folks could kind of browse by themselves. And the other thing that's going to be really important here is that starting this summer, we're going to have the service locator tool. So the service locator tool bid was just awarded a couple weeks ago. And this is going to be a real-time tool that folks can use to see what treatment options for SUD and for mental health are available that day. So instead of having to kind of call all these different treatment centers and see whether or not they have openings, the goal of this service locator tool is going to have it all kind of be in real time, so folks can have easier access to the treatment that they need without getting discouraged by calling multiple treatment centers that don't have openings. So that's also going to be up here kind of later this summer. But again, that tool was just awarded a couple weeks ago, and I don't expect it to be out until at least June or July. Now, the other part of this discussion is obviously the data. So here you're going to have some links to the different data websites in Maine, as well as we have the national CDC data here. Before I get to that though, a lot of folks, a lot of people on this call probably know what all the terms that I just said mean. But for a lot of folks, particularly affected family members or people who are friends or young folks who just really don't really know what we're talking. They know that there's a problem and that they might want to look for something called recovery, but what does that actually mean? And so that's why we have a glossary here where folks can kind of look into what is the difference between primary prevention and tertiary prevention. What is harm reduction? What are certain service programs? What are the different things within recovery? So that's why we wanted to have a glossary for folks to be able to educate themselves. We have some information on COVID-19. And again, the other thing here is the main drug data hub. So before I jump into the drug data hub, did folks have any questions on the website that I can help answer?
I think my main question for you is if folks have suggestions of materials or resources to add to the website, I guess the best way of doing that while this is still new. I know there's a lot going on, and I know that you've tried to capture almost everything going on, but there's new things popping up every day.
Absolutely. So that's why, and that's a super important point. We want feedback constantly. So if you have feedback on the website or on the campaign, you can email me at any time. If you'd like to add a resource to kind of this resources page, at the bottom here, there's a drop us a line kind of link. And then you can just, we're actually going to revamp this so that it's not just a simple message. But for the time being, you put your name, email, just say, hey, I'd like to add, my local service, or I saw that this service or this recovery center, wasn't available, could we add it? And then absolutely, we've been updating things, on a weekly basis. So, I use the term 100 resources, but I think we might be at 110, 120, because people are adding things every day and reaching out to us. So that's a great question.
And I think Sue would put into the chat, is this mobile optimized? So does it flip based on what sort of device you're on?
Yes. Yep. Yeah, it's optimized for iOS and Android as well.
This is Kate. I have a quick question if I could ask.
Yeah, absolutely.
Oh, great. Thank you. Just wondering, because I work for We're Recovery Care, so that's a private organization. is that kind of a service that can be listed as well, or are the service listings that you're talking about, are they primarily nonprofits and things like that? Just trying to understand the parameters.
Yeah, absolutely. I think we're open to any resource. I think what we would put in, so let's take an example here. And I think if we let's see, we just look AMHC as an easy one. So you see, you click on AMHC, you have the phone number, you have their website, and you have a short description. Because that's the other thing for folks who don't know. We want to make sure that there's a little thing that they know who they're calling and they understand kind of what services you provide. So in this about resources, what we might say is that this is this is a for-profit, you'll have to pay for services type of thing. But again, we absolutely want to list it there because there are folks who are looking for those services. So we're not discriminating on the type of services.
Okay.
As long as you're willing to, as long as you're helping service
Keep the data,
yeah. We want folks to have that option.
Okay,
again,
great.
know your
I'll share that
options.
information. Yeah, thank you so much. Great.
Of course. Any other questions before I kind of go over to the data side?
Roland, this is Frank from MEHAF. I have a question. So, I was curious too, in terms of searchability for the site, like when you just go into a search engine and you put in options main, like it comes up with a press release from the governor's office, but for some reason it's not like the way it's mapped. I wondered if any thought's been given in terms of how to make that, for folks that are just hearing about the program, how to make it as easy for folks to search as possible. Because I know that we've even had that issue with our, some of the materials that we put on our website, and just trying to think how to make it as easy as possible. Because I don't know if folks would remember know your options as a way of reaching the resource.
Yeah, absolutely. Yeah, we've struggled with that a little bit as well, Frank, and thank you for that question. What we've tried to do is do kind of ad buys with Google. So if that people look up know your options or options main or options save lives, we try to have it so that our website comes up first. One of the things that we realized, unfortunately, afterwards, although it was that knowyouroptions.com is I think it's like Fannie Mae or it's some big national
it's Fannie
Mae.
Yeah, I came up with Fannie Mae first.
Yeah, exactly. So that's kind of hard because they're obviously doing their own purchases and making sure that their website comes up. So we've been battling that, and again, this is week 3. Week 3, or maybe we're just entering week 4 of the campaign starting. But we're trying to do different ad buys or search engine optimizations to make sure that it's in the top 3. But happy to discuss with you after that if you have questions. But we're definitely we're doing our best to kind of make it search optimized so that we're near the top.
Great, thanks, Roland. And just to say also, it looks amazing. Like to have pulled so much together in such a short period of time, it's really very
Thanks so much.
Roland, this is Dr. Carmen. I again, like every time I see it, I'm amazed by it. So it's really great, and your presentations are great. So if a provider knew of someone, could they contact you too? Besides, if they didn't think to go through the website, like say they knew of a story or someone who was interested, are you sort of still, we should contact you?
Absolutely. Yep. If you have questions and you're not really sure, just contact me. Anything that comes, around the website, around the public health campaign or sharing their story, please reach out to me anytime. Again, I can put my email in the chat. One of the things that we're also doing, again, the other part of the options campaign is these options liaisons. And so, as those get hired in every county, if you go to under about options, we don't have them all listed here because I don't have all the information yet. But there's going to be the information for each options liaison, so that people can reach out to the one that's specific to their county. And that person, again, their whole role is helping with referrals, helping kind of people connect to the resources, you know, that are, you know, appropriate for them. There's also the contact information of Sybil Masrol, who kind of oversees that part of the options program. But you know, you won't, you know, if you email me, I'll get back to them, or I'll connect them with the right folks.
And the other day, there was like a whole article in the Bangor Daily News about like the ride-alongs with the Penobscot County law enforcement. Is that, but it didn't really mention this. So I was trying to tell from the article if it was this, the options liaison, or was it something different? Do you know what?
So I assume it is this, but I know that so Bangor in particular, excuse me, has its own. It has a Penobscot-wide options liaison, but they also got money for like a specific kind of like Bangor response team.
Yeah.
And so it might be, I think they're connected, but having not read the article, I'm not sure which one they were promoting.
Okay. I'll find it.
Mhm.
Well, and I think it was the other group. I don't think it was the option liaisons, because they're not supposed to be doing actual ride-alongs with law enforcement. It may have been, the article may have been about the other individuals, but they all are communicating and working together on.
Great. That's what I just felt like. It sounded a little different when I was reading it, and I thought, is this in addition or side by side? Okay, thank you.
Yeah, of course. And again, and that's a really good point, that these options liaisons aren't ride-alongs, right? So they're not in the cop car, you know,
Okay.
with the responder kind of just going to different events, because you know, once in a while it might be an overdose, but they'll end up sitting, you know, for a traffic stop or something like that. So
Right.
you know, and that's time that they can be using to do active outreach, to do post overdose kind of response. And so they have their own cars, you know, they have their own schedule, but they're connected with you know, local first responder. And so again, most of the time that's law enforcement, but some of the time that's kind of like EMS or somebody else. So it really depends in every county. So any other questions? These have been great. All right, well, so the next really exciting thing, this I cannot take any credit for. I'm absolutely just the messenger. Oh, and before I forget, Gordon does pass along his hellos. He's sorry that he can't be here. We're both double booked for this time, but he passes along his hello. And so this is really the work that he and Rebecca Taylor at OBH, who's the Deputy Director for Data and Evaluation, have been working on with the help of UMO. And so over the past few months, since last fall, they've been bringing together an opioid data sharing committee that meets monthly. And it has folks from the DEA, from DOC, from EMS, from OBH, from the Maine CDC, from OCFS, from everywhere you can imagine in state government. And the goal is to collect data and kind of make the data more available to the public and to policymakers. So this is launched a couple weeks ago in tandem with the options campaign, but is very much still kind of under development as well. And so if you have any questions around kind of, you know, you want a certain type of data or you're not seeing what you're looking for, you know, you can reach down here at the bottom, the support mainedrugdata.com, reach out to them and they can kind of answer your question. But the goal here is, you know, are you a government official? Are you a researcher? You know, are you a grant writer? Are you just a member of the media who's looking for more information? Or are you a person in recovery or who's been affected by the opioid epidemic? And depending on that, you know, you can kind of look at different types of data. So there's naloxone distribution data, there's EMS data, and there's all, you know, different types of reporting and dashboards. So this is I recommend you kind of look through this a little bit yourself and kind of see kind of what, you know, they have so much information here. So it's really dependent on, you know, who you are as a person and kind of what you're looking for. And again, if you don't find what you are looking for, you know, that email at the bottom will be able to kind of tell you, we'll be able to kind of respond to you and kind of help you find that data. Because I know I was just talking with Rebecca yesterday, actually, and you know, how are we supposed to be making, you know, the right decisions on policy or anything else when we don't have the right data, right? You know, anecdotal stories are extremely important. They're emotional. They're what will, you know, bring us to act. But particularly as policymakers, you know, having the right data and really knowing, you know, what's going on from that, you know, 30,000 foot level is really important. So that's kind of the goal of this website, is to do that. And then here, you know, we'll kind of see kind of the naloxone information, naloxone being distributed. And that, again, is thanks, or at least this is statewide through government purchasing. So I'm not as much of an expert as you might be able to tell about this website, but it's there. And I'm happy to kind of take any questions and get answers back to you. But, you know that it's there, and know that, you know, just like the options website, Rebecca and Gordon are very open to kind of knowing how you want to use it and kind of developing and changing it so that it fits everybody's needs. I think I'll just take questions, and then I have some general state updates, and I know I'm running out of time here. But again, thank you so much for having me.
Roland, I have a question, like, I'll let you have your water. Is there any plan for, like, from like social media things, it's good to like kind of keep getting it out there? Like, are you going to have Twitter or Facebook, like, you know, ways to get people to come to it? You kind of have to push out your website all the time. Are there plans around that?
Yeah, absolutely. So if you, so just going back to the options website, if you go down here, you can check out kind of our Facebook page. And so, you know, right now what we've been doing, you know, we were doing organic posts. Then, you know, we're kind of promoting our posts through paid social media. And a lot of that right now has been around kind of the videos that we created, you know, kind of some stuff around the Good Samaritan law. So we're absolutely kind of pushing, and I think we doubled our followers here in the past week, thanks to, you know, kind of the different presentations and also the kind of Super Bowl ad. But absolutely, you know, most people, or I don't know if I should say most people, but a lot of people now, you know, get their news or get their information from social media. And so we're absolutely kind of, you know, pushing kind of our, you know, website and also our message, most importantly, through social media channels. And again, you know, right now we're just we made a lot of presumptions on, you know, if you look at the opioid overdose data, you know that there's two peaks. So folks that are in their mid 30s and folks that are in their mid 50s are the ones who are most at risk to overdose. So that's really important, because if you just say, well, what's the average age, you'll find that it's 41, but the 41 is actually at the dip between kind of the bimodal structure of the data. So absolutely, we're pushing through social media. Like us, share us, you know, and also we're also working closely with the DEA around kind of their Wake Up Maine campaign. We're working closely with the Eyes Open campaign from the Maine CDC, and you know, the goal is to kind of intermingle our messaging and to kind of, you know, push you know, share and collaborate rather than siloing, which is kind of what was happening in the past. Yeah.
Roland, I was just wondering if you, I think the stories, as I said, the stories are wonderful. I'm wondering if you have access to, or maybe Dr. Carmack or Dr. Woods, Dr. Farley Mock have access to some medical professionals or people who are not the typical stereotypical people with substance use disorder, willing to share their stories, as I feel like that would really send a message that it's cuts across all lines and all aspects of life. That's not just the people that you would typically think of who have a substance use disorder. You know, maybe somebody who's in their 60s or 70s, who's been battling, you know, opioid medications, you know, like we've, you know, I just know that there's folks out there. I was thinking of, I can't think of the doctor's name. He was at the Veterans Summit that I went to a year ago now, and he speaks very comfortably about his substance use disorder, but just to sort of stretch the thinking of people who have substance use disorders.
Yeah, absolutely. I think that's a really good point, Jen. I think we've been trying, but again, it's one thing for folks to kind of share it in a group meeting,
It's
and
true.
for it to
It's
be
true.
like online for everybody to see, even if we just
Exactly.
put the
I
the
respect
first
that.
name. And it's not even that we're against putting it on there. We've kind of done a lot of outreach saying, hey, we're looking for stories. Whether it's in writing or in video form. It can be a minute, it can be 5 minutes. But it's just that we've had kind of a harder time getting folks to be willing to share that story. So absolutely, if you know of somebody or anything who wants to share their story, and right now it's kind of opioid related, but if it's stimulants, I think I want to kind of open this up and make it broader. But right now it's just that we haven't had, luckily we had these folks from the opioid summit who had shared their story for the opioid summit this last summer, and now they were willing to kind of let us share it through the website. But we've had a hard time actually finding other folks to join us. So I know that I'm past time, so the last things that I will note is that, again, we do have the new strategic action plan that was released last week, that was approved by the governor. You can read it and download it here on our page in the about, strategic action plan, the service locator tool we discussed, the summit. So we're doing monthly seminars on the first Friday of every month. The new one that would just happen was on the strategic action plan and on the options campaign. The next one in March is going to be an hour on those options liaisons that we talked about. So definitely keep an eye out for that invitation. And again, we've sent out the call for abstracts for this summer's summit. So if you are interested in presenting at the summit, have an idea, definitely we look forward to hearing from you. And that deadline is March 6th. And if you don't have that kind of call for abstracts, just let me know. I can send it to you. And another big thing is that, again, it's very hard. We're trying to do the options campaign to raise awareness, but it's really hard for everyday folks to be engaged when the numbers come out every 3 to 6 months on kind of the overdose deaths and so forth. And so starting this month, the Attorney General's office is going to be releasing overdose numbers on a monthly basis. And so starting next week, the Attorney General's office is going to release numbers for January. And then in March, they'll release numbers for February and so forth. At an internal level, Gordon and I and a few others, potentially Dr. Carmack, we see overdose deaths on a weekly basis. We know by Tuesday or Wednesday how many folks died the week before. And so the goal is to really kind of share that knowledge and share the urgency with the general public. So again, sorry for going over, but thank you so much for having me, and happy to answer any last questions, but I also know you have your own updates to do.
No worries about going over. This is useful time and information for all of us, so don't worry about that at all. Other questions?
I'll just mention, Kayla, that those 2 documents you sent me, Roland, about the strategic plan, those were both attached to the invite, as well as a PDF that explained the Governor Summit and deadlines and links. So, but if you need that, we also have that information to send to you.
Perfect. Well, thank you all so much. I have to hop on another call, but it's been really nice being with you all, and happy Wednesday.
Thanks, and thank you, and for all the work you've done. Thank you.
Thanks.
Great. So we do have some time left if we want to go around and give some updates. There's been a lot happening in the past month, it feels like. So it'd be great if we could hear from all of you about some updates you might have, or work going on in your area. So I will be quiet and let you all unmute yourselves and share if you have something that you would like to share.
I'm already unmuted, so I'll go first. I just wanted to let everyone know we've started the plan of safe care, which is something that should be in place for infants born substance exposed. And so it's been in the works, and in the fall, a nurse was hired at OCFS to be the plan of safe care nurse, which was really what we needed to get the work started. And she's done education at all the birthing hospitals to the caseworkers. She collaborates with public health nursing and community partners so that when an infant is born, then it's been identified as substance exposed, not only is there a notification to OCFS, which is required by law, our state law, which kind of falls in line with the federal law that states should do that. We now are working to create a plan of safe care, which was the intent behind the law of identifying these infants to help support the family and the caregivers of the substance exposed infants. So you may hear more about the plan of safe care, and it actually is really a collaborative effort, because the idea is not for these infants, all the infants, to come into DHS custody. The idea is to help families to successfully care for and nurture their babies. So a lot of work behind the plan of safe care. So that's been going on at OCFS. And then also a substance use disorder, adolescent substance use disorder specialist. I wanted to get the term right. It has been hired. She's a one-year position through the Gorman Foundation funded a position, and she's working to help sort of just really get a good sense of what there is available for adolescents and what we can do to really improve on that. So that's Madeline Shiley. And so I've been kind of working with her to gather information. So those are two important updates.
Thank you. That's great news.
Kayla, can I ask a question?
Yes.
Adrian, I was wondering, so in terms of the self-care plan, what's the time span that's usually designed for? Like, is it the first 12 months, or like I don't know that much about it.
Right. So the plan of safe care, actually, there's not like a mandate around the time. We're saying that it would be really great for it to last for the first year of life, but also really we're hoping our first phase of implementation was that it's happening created at birth, but really ideally a mother would start to create a plan of safe care while pregnant. So that's sort of our next stage, working with the CDC and the program manager around substance exposure, Dara Fruchter, she is working with us to go really just talk to people working with pregnant women, that they start to think about this plan of safe care, because it's a lot when a baby's born in the hospital to meet with the mom and come up with all of this, where these are things that if they were in place, she'd have a more successful, opportunities to engage with things like public health nurse and Maine Families. But then the idea is that the primary care providers would also continue the plan through the first year. So we actually have a training today. If you want me, I'll actually put a link to the Zoom. It went out to Maine Care, and we've put it out there a lot of places, but we're doing a training today about it if you want more information, or I could, do that. We have a presentation that we can do, or we have tape recordings of it.
That's great. Thank you so much. Yeah, the link would be great.
Yeah, I will get the email.
Is that the meeting that's at 10 o'clock with Dr. O'Connor? Or is
No.
that a different? No,
Probably
okay.
a different one. That's probably with the mom grant.
Yes, yeah.
So it's really like simultaneously, and we work really closely with the people of the mom grant, because the timing of all of this happening is really great. But yes, people, the mom grant is a separate group that's out of OMS. We're out of OCFS.
Okay.
Our goal is that
I'm still
women
getting
would
it all.
I know. The goal would be that that women would be engaged with the mom grant and have treatment, and they might have a notification for Office of Child and Family Service when the baby is born, but they would have a plan of safe care, and the baby would be able to safely go with mom, you know, who's in treatment and has services. So that's our goal. Yeah.
Could I make a suggestion about your adolescent
Yes.
staff member? We have, so I'm brand new, as you can see. I'm not brand new to Maine, but brand new to Tri-County Mental Health Services. I've been up there about 4 months, and we have multi-systemic therapy programs, 2 programs. And so that Madeline would be wonderful to outreach to the MST programs in the state and work, because these are the issues that are popping up, are adolescents with substance use disorder issues.
And the MST programs are like within Children's Behavioral Health. So she will be, yes. So she's working under Anita Hood, who's like one of the behavioral health managers. So I'm sorry I wasn't on at the beginning for the introduction. So I'm the medical director with OCFS. So we have a lot of different pieces that we're trying to tie them all together, which is
it's wonderful.
So,
wonderful.
So Jen McCarthy, I'll write your name down. Thank you.
Thank you.
I think I know yeah.
This is Sue from the Maine Medical Association, and I can give a little update on MICUS, the Maine Independent Clinical Information Service. And I think most of you have heard our updates before. Elizabeth is our lead academic detailer, and we are offering both individual one-on-one academic detailing sessions on opioid prescribing topics, as well as a 1-hour presentation. Elizabeth's presenting today for Greater Portland Health, and we've got York Hospital and a couple of other places coming up, and also offering 3 different topics for the individual sessions for opioid prescribers. And so there's a bunch of descriptions on our website, which is MICUS Maine, MICISMAINE.org, or you can contact me for more information. And also, I think many of you, if not most, have met or been at a meeting with Fran Jensen, who is the medical director for Office of Maine Care Services, or DHHS. I'm not sure exactly where that all fits, but she has been connected to us since our contract started in July, which has been great. So we have started having quarterly meetings with her, and now with Jan Wright, who is program administrator for our program. The funding comes from Office of Maine Care Services, or comes through them. And so we've started having quarterly meetings. We'll be meeting with them again in March to talk about the next contract year, different topics that may be considered, and see where MICUS goes for the next contract year. Again, you may recall our contracts in the past have been calendar years, and starting last year it switched over, and so now we're doing July to June. So we'll be continuing to do our focus on the opioid topics through June, and then we expect at least some of it will carry into next year. So we'll keep giving you updates on what's available.
Great. And I'll just add on to what Sue just updated as an extension of sort of that academic detailing work. We're partnering with Maine Care in the state to offer some more applied coaching parts of that, I would say. So Elizabeth is also involved with that. But the state has some funding to really look at working with primary care practice sites, and not just, here's the education, now what? And it's really the next step of helping them put that into practice, really focused around MAT prescribing and various sorts of elements that go along with that, such as polysubstance use and how to handle some of those conversations with patients. So we will be kicking off that work in the next month or so. We're just in the planning phase right now, so we will keep you all posted as we have some updates on that and some announcements for it.
I'll add in as the third step that it's really exciting. There are so many different programs. I actually had to put together a list for the Bangor area for our regional opioid clinical work group. There's so many different programs now available to prescribers for education, for sort of group think, group support around opioid use disorder. It's just amazing. So I also work on a grant from Aetna Insurance that provides education to providers. So if there are providers in Maine who feel like they need more one-on-one information or didactic learning, there are a lot of resources now, which is exciting. Just like there's no wrong door for the patients, there should be no wrong door for the providers.
Yeah, it's amazing to see how much our state has changed in the past few years, and what a supportive administration and a flood of resources can help provide. So it's definitely great to see all of these programs coming into place.
I can piggyback on that.
Yeah.
We have a syringe exchange program. I don't know if you all know that. It's in our Lewiston. It's the box is outside of our Lewiston campus, and I can send you, Kayla, if that's helpful, or Mary, the flyer that we have. But we've done really well without a lot of advertisement, and just recently we started to do some Facebook and social media and radio ads, but it's wonderful. And you know, it's so progressive. We know that this is on the road to other things, and so we're really excited about it. And the harm reduction specialist that we have is also a substance use disorder clinician. So she works, her name's Erica West, and so she works with the clients, you know, when they're disclosing and talking about their substance use disorders, and they're open to treatment, and so she eases them into that whole process. So it's such heartwarming work. So I wanted to share that.
Great. Any other updates from folks? All right, hearing none, we'll go ahead and let you go. We'll send around follow-up email with the various resources. If you send them into myself or Mary, we'll make sure those get shared with the group. And I hope everyone has a great rest of your day, and we'll see you again next month.
Thank you.
Great
Thanks,
meeting.
folks.
Everyone.
Thanks,
Terrific.
everybody.
Great.